Right, Aston medical student will be expected to learn the contextual part of the curriculum, but also the non-technical skills, the soft skills. So if we talk about the contextual, then we would like them to learn the curriculum, but in a modern way, in a way that comes from the end point. For example, giving them the presentation, which is chest pain, and going from that backwards and see how they are going to reach the diagnosis. This is a good way because it will be the hands-on, is actually how the patient will be presenting to them. We expect them obviously to learn their stuff, which is the knowledge-based information, but on the other hand, we will teach them in the junior placement, which is in year 3, how to behave, how's the professional identity present in contact with patients, how to interact with these patients, how to interact with their family, how to interact with their peers, with their seniors, with the consultants, nurses, other professionals on the wards, lab technicians, pharmacists, how actually this whole team can together serve the patient for the best care. Moving on to year 4, it's the specialty year, which will give them a spectrum of attachment to specialty, including child care, obstetric and gynecology care, cancer care, acute care, psychiatric care, and integrative care. The latter one is quite important and the modern way of bridging the interface between community-based medicine and acute hospitals, shadowing the patients with their journey in these integral pathways and seeing where the specialist in the acute hospital can safely discharge these patients in transient way to the community hospitals before they are fit enough to go home. Moving on to the senior placement, which is in year 5, whereby Aston medical student will be having their exams and then proceed to relatively long apprenticeship model for a total of 18 weeks, 6 weeks in medicine, 6 weeks in surgery, and 6 weeks in community medicine. In the clinical placements, we will still have 2 levels of support. The hospital level itself, where they are spending majority of their placement, but also the base support, which is the school support level. So in the hospital, they will be allocated to a consultant, and there will be the main first level of support. With the consultant, there will be a team of junior doctors and clinical teaching fellow. So each 4 to 6 students will be allocated to one clinical teaching fellow that will look after them on day-to-day basis, and any academic need, it goes back to the consultant, the named consultant that they are attaching to. Each hospital will have a liaison, Aston liaison officer, who will be selected consultant with a special interest for medical education, will be representing Aston school in the clinical placement, i.e. the hospitals or the general practitioner, and this person will be the next level that the student will get in touch if there is any further concerns.